Welcome back. It's still Morning Rush on Metro Television. November is the month to create more awareness on diabetes. And like I stated earlier on, it's a month where most hospitals, communities and individuals create awareness for diabetes. And also in Ghana, there are about 2.4 million people living with diabetes, and approximately 7.5% of adults have type 2 diabetes. And that is on the website of the World Health Organization. Despite the alarming prevalence of diabetes in Ghana, many people may have still not been diagnosed, and there's a fear of a number being higher in the coming years or months. We never know, but then there's a prevalence that is rising. So it is important, it's imperative that we have this conversation this morning, and we have Dr. Duke AGBODEKA. Yes, I had to take my time. He's an internal medicine resident at the Greater Accra Region Hospital. And also we have EVELYN AGYAPONG, who is also the Senior Health Promotion Officer. And will be telling us the activities, but most importantly, talking about what exactly diabetes is. Good morning. It's good to have you on Morning Rush.
Thank you.
I mean, let's start from the basics, because in times where we get statistics, it becomes very fearful that something is actually going on, and it's repeatedly, we don't really know how fast it's going. So let's start from the basics. What exactly is diabetes, and what are the types? Because according to the report, it says 7.5% of adults have type 2 diabetes. So we talk exactly what exactly is the definition and also the types of diabetes.
Okay. So good morning once again, and good morning to all our listeners this morning. So diabetes is a chronic disease. It leads to elevated or raised blood sugars. And when your blood sugars are persistently raised, it causes damages to your organs. So basically, that is the definition of it. It's chronic, meaning that it is a long-term, persistent condition. And it's as a result of various malfunction of certain organs in the body that would lead to this. Now, the types. There's the type 1, which in the past was referred to as insulin dependent. That means that the body is not able to produce insulin. Now, insulin is a hormone that's supposed to make sure that the body tissues, the organs in the body, take up the blood sugars out of the blood so that your blood levels are normal. Your blood sugar levels are normal, yes. But where you can't produce insulin, which sort of like the key to allow the blood sugar to enter these organs, the sugar just remains in the blood. And when it continues persistently like that, then it causes damage.
It's dangerous.
Yes, then it is dangerous. Then we have the type 2, which mostly occurs in adults. The past, we would say above age 40, but we are seeing younger and younger people develop it because of the lifestyle we are living, which I'll come to shortly. So type 2, in type 2, insulin, which is supposed to open the door for the organs to take the blood, the organs do not respond to the insulin, so they are sort of rebelling against this hormone. So the insulin tries to open the door for the blood sugar to enter these organs, and the organs will not allow it. So it's what we call insulin resistance. So there's some resistance to the instruction that insulin is trying to give. So that's the type 2. There are other types. I must mention gestational diabetes. We can't leave that out. That occurs mainly in pregnancy. And at some stage of the pregnancy, it is noticed that the blood sugars that are acceptable for the normal fetal growth are quite elevated and would be harmful for the baby and to the mother as well in the future, because once you have developed gestational diabetes, you are at risk of developing type 2 diabetes. It's an overdrive of a physiological adaptation where your pregnancy hormones try to make available enough blood sugar for the baby to take from the mother.
Okay.
But then when it's done excessively, then it leads to gestational diabetes.
So it can be inherited?
It can.
Okay.
It can. So you have an increased risk when one parent is diabetic. Your risk is increased, sort of doubled,
okay.
increased when both parents are diabetic.
Yeah. Evelyn, let me come to you. How often do people come to the hospital and say that, oh, I know that I have diabetes? Do people really know?
They don't know.
Okay.
Sometimes when they come, when they are sick and they come to hospital before they get to know that they have diabetes. Okay. But for them to walk in like they are coming to check for their blood sugar, they don't come until they are sick. Until
they are sick. Yes. And that's very risky.
Yes.
That's very risky because, I mean, there are so many, like you said, who come to the lifestyles and everything, but then we get people walking into the hospital, maybe I'm feeling ill, I want to check this, but for that particular one, people hardly come.
They don't come.
To check that. Okay. Now, Doc, let's talk about the causes. What actually causes diabetes?
So, causes per se, largely it's an interaction between the person's genetic makeup. That's what you've taken from your parents.
Yeah.
And then also the environment. And in this case, the environment is the lifestyle you are living.
Yeah.
Poor or reduced physical activity, not exercising enough, which we refer to as a sedentary lifestyle, causes weight gain. Obesity, right, would also cause you to accumulate a lot of fat. Fat in itself produces certain hormones that fight the insulin and causes the other organs to rebel against the instruction that insulin gives. So you develop type 2 diabetes because of that. Alcohol taken in excess can lead to that. And basically the consumption of simple sugars or carbohydrates that are simple. So in such cases, your eating habits is poor. You are not taking in complex carbohydrates. And when I say complex carbohydrate, I mean diets that have that are rich in fiber.
Okay.
Yes, and would not release a huge sugar load into your bloodstream after a meal.
Okay.
Yes.
I want us to touch it bit by bit. When we say excess alcohol, like how do you know that what I'm consuming is excess? Because let's say today's Monday, someone closes from work, just 1 beer or something, like, and then tomorrow, or what is the excess, the definition of the excess that can cause that particular issue?
So there is a technical definition. It will be hard to explain, but then...
break it down for us.
Yes, so there are a number of units that you can calculate from alcohol, yes. Now it's accepted that it becomes excessive when you are taking more than 14 units a week.
A week?
A week, yes. Okay. As to how to calculate it is going to be difficult.
The week, I get it.
Yes,
I get
yes.
it. I get it.
So over 14 units in 1 week, you are pushing it too close to the limit.
It's too much.
Yes.
And 14 weeks.
Yes. 14 units.
14 units.
Yes.
Okay. So that means at least within two weeks, a split of 2 weeks, maybe let's say once.
Yes.
Not like continuously. Okay.
So to make it easier for you to understand, it's like taking hard liquor, 40% alcohol, in 1 tot. 14 of that is what is. So taking 2 or 3 beers a week is not excess. Yes, you will probably not do more than 4 in a week if you take that
But
amount.
the hard alcohol?
Yes. A tot, that is 25 mils of hard alcohol. That's 1 tot. 14 of that in a week. It's
very serious.
Yes.
Food that contains a lot of fiber. Let me come to Evelyn. Which foods like really contain a lot of fiber that you say it's advisable for us to be consuming?
Like millet.
Okay.
Rice.
Okay.
Wheat. Oats.
Okay.
Yes.
Those kind of food contains a lot of fiber.
Okay. And what you mentioned, mostly they are taken in the morning. Now let's come to the afternoon.
The afternoon.
Because I can't really take millet in the morning, or let's say oats in the morning, in the afternoon, in the evening. So like let's split it. In the morning, I know what my breakfast is. So this morning, because of you, I'll eat oats. Then in the afternoon, let's say there's a portion of rice.
Yes.
Then in the evening too.
Yes. So in the evening as well, the complex fiber or the complex carbohydrates is not only found in the main course as well. The vegetables also have.
Okay. Also help.
Yes.
Okay.
So your cucumbers, you have a
cabbage,
lot of
lettuce.
cabbage, exactly. All of them have complex carbohydrates that will not really
cause any issue.
Yes, overburden your hormonal system when it comes to blood sugar control. Yeah.
Now let's talk about the symptoms. Like you said, nobody even comes to check. But then in case I'm experiencing some signs and symptoms, what do I look out for? What are the red flags?
Okay, so I must iterate the fact that close to about half of people don't know that they are diabetic.
They are diabetic.
Or they are on the pathway to diabetes.
I'm included.
So that's why we are here this morning, want to create that awareness. People must go and check their numbers. People must know their numbers. But then when it becomes overt and we say you have diabetes, then the person would complain of increased thirst. They will complain of passing frequent urine, and not just frequent urine, but large volumes at the time. Anytime they go and pass their urine, there's weight loss, and then there are a lot of skin infections, blurry vision.
Oh,
yes, dizziness.
Fatigue.
Exactly. And someone explained on wellness what we call malaise. You just can't pinpoint exactly what is going on. Muscle aches and all that. So we tag a lot of these symptoms, especially to malaria. Malaria is being overblamed for a lot of things. But we say that if you test for this and you don't get it, go to the hospital. Please make sure that you see a physician, you see a doctor, see somebody who can listen to your history and then try and figure out what is going on.
Okay.
Yes.
Everyone will be coming in soon to take us through the activities, what you plan to do. But then how is it diagnosed?
Okay. So the diagnosis has to do with identifying the blood sugar levels, and there are several criteria. We check your blood sugar. There are blood sugars that we can check when you haven't eaten, and then 2 hours after you've eaten.
Okay.
Then there are other diagnostic instruments that we use, what we call the oral glucose tolerance test. That's mainly for the pregnant women in testing for gestational diabetes, although it can be used to diagnose the other variants of diabetes as well.
Okay.
And then there are other diagnostic tests.
Okay, that is conducted.
Yes. So mainly what is being identified is, has there been a persistently elevated blood sugar level? Yes. And then there are other things we look out for. So before even you may present with overt diabetes, there might be damages already done to their organs. So people who come in with blurred vision, their eyes are already gone because the persistently elevated blood sugars have destroyed their eyes. So sometimes they present to their eye doctor before they know that they are diabetic. Or somebody persistently having infections, skin infections, nail infections, vaginal discharges. And it is when they come with symptoms that we identify. I must say that at that point, it's far gone. It's become overt. But there are points in which, if you went to the hospital right now, we saw your blood values of your sugars, and we would say you are in a pre-diabetic range. Increased physical activity, good dietary habits can reverse this.
Okay.
Weight loss.
Okay.
Yes.
Daily exercising.
Yes, daily exercising increases. So 45 minutes of aerobic exercise at least 3 to 5 times a week.
Okay.
Losing weight, at least your body mass index, and yes, when you go to the hospital, you'll be told about what adequate weight range you should be in for your height. Yes.
Okay.
Yes.
Okay.
And then your diet, very important about what you eat.
Okay.
Yeah.
Evelyn, can you, it's really a lot, it's really a lot.
True.
But then can you tell us what are the activities lined up that the Greater Accra Regional Hospital have in terms of creating more awareness for this particular month?
Every 14th of November, we organize free screening on diabetes for the public.
Okay.
But this year, because diabetes and hypertension, they are on the rise and they are like sisters. They work together. So this year we are merging the two on the 14th of November at Rich Forecourt in front of the new building. So we are starting the screening at 8 o'clock to 2 p.m. And then after the screening, we are not going to end there. There's a wellness clinic at Rich Hospital. That wellness, you don't have to go and queue. You don't have to go through the main OPD to pick folder, go and see a doctor and all sorts of things. You just walk in. It's a walk-in clinic. You walk in at any time. You go there and check your BP, check your sugar. They go through so many labs. So after the screening on the 14th of November, this coming Tuesday, we are not going to end there. After the screening, you can walk in at the wellness clinic at family medicine department at any time. Then on the 14th, 18th, we are going to Ayi Mensa. Since doctor said we have to burn some of the fat, we are going to do aerobics.
So you climb the hill and then you finally do.
So we are meeting at Ayi Mensa 5:30 on the 18th of November. And then from Ayi Mensa to Pediatric. So we are inviting everyone, the public especially. Everyone should join us. Like you, we are inviting you. We are inviting media stations. Everyone should join us on the 18th as we climb the mountains.
So on the 14th, that is a week just like today. That is when the screening will take place at the forecourt, like let's say at the Ridge Hospital. And then on the Saturday, that is the 18th, is the health walk that will happen at Ayi Mensa. That's very good. But then also, if someone is not able to check, maybe because of work schedule and everything, within a stipulated time, apart from that particular time, is it expensive to come and check to be diagnosed or get yourself screened? Is it expensive?
I don't think so.
It's
no,
not expensive.
It's not expensive.
Like when you come work in the morning and you have a leisure time, like 5 minutes, you can just drive to the wellness clinic. They will check it for you, then you return.
Yes.
That's very good. I mean, we've had an interesting conversation on this, and like you said, you're hoping other media stations will come on board to help, and we also hope that you continue the awareness, even sometimes outside the month that is actually for that particular illness. But then, Doc, we are wrapping up very, very soon. Anything that you would like to add that we haven't really touched on? Yeah,
so there's a society that makes sure that we continue this awareness all the time. It's the Diabetes, Endocrine, and Metabolic Society of Ghana. We, in short, DEMSOG. It's made up of doctors, nurses, pharmaceutical reps, a lot of people that have taken this burden upon themselves to look at these conditions. So, yes, DEMSOG will be part of these activities as part of Ridge Hospital's program. And, yes, would be at the Ayi Mensa Pediatric walk.
On the 18th?
Yeah, on the 18th, yes.
Thank you very much, Dr. Dukweku AGBODEKA, who is also an internal medicine resident at the Greater Accra Regional Hospital, and also EVELYN Agyaponge, who is a senior health promotional officer. And this morning, it's all about diabetes awareness. Like she said, there'll be something amazing going on for people, for the public to actually pass by. Exactly today's week, today is the 7th, next, exactly a week today is on the 14th of November. Just pass by the Greater Accra Regional a hospital and get yourself checked. And like Evelyn said, it doesn't cost much. Even if after that stipulated time you're not able to check, you can just walk by anytime and get yourself checked. And also join them on the 18th. That is very, very important because health works are very, very good. I live in Adenta. Maybe you might see me there even before joining you. So you should join them. Let's say the time will be 6, yeah, because that's the time you get to, the weather is very conducive for you to climb the hill, yeah. So you join them on the 18th of November 2023, Saturday. I mean, just put everything aside. Maybe you haven't worked out through the whole year. Hey, it's serious, so join them and make sure that you participate in that. Thank you very, very much for coming this morning.